Hi everyone, my name is Miñana-Signes, and then I will present the work that is titled Health-Related Back Care Knowledge in Primary Education. What is the level of knowledge from Spanish school children? Dr. Monfort-Pañego, Professor Bosch-Viviat, and Dr. Knoll have participated in this work. We composed the Back Health Education Research Group from the Teacher Training Faculty of the University of Valencia. We hope you enjoy this presentation. As the constructivist theory and the significant learning says, all new knowledge and competences are elaborated from existing knowledge and competences. It means that to teach something new is necessary the application and extension of existing concepts and ways of knowing. Hence, to achieve this valuable initial information and prior knowledge of the students, several authors designed and validated reliable assessment tools about educative content related back health for use in school setting as a formative evaluation. Currently, it is known that knowledge regarding back health is very poor. The necessity of providing students with appropriate knowledge, skills, and attitudes to lead personal well-being is a goal of both physical education teachers and the entire educational community. Knowledge is a determining factor for the development Some studies have carried out intervention programs about back health education in the school setting in order to improve knowledge in school children. For instance, a popular back care education program developed by the research group of Cardon et al. Was developed in a sample of 4th and 5th grade elementary school pupils. The program consisted of 6 sessions of 60 minutes at 1-week intervals. Sessions were based on guided discovery and active hands-on methods such as games and dramatic play. Contents were related to children's daily activities like getting out of bed, brushing teeth, sitting at a table and carrying a book bag. Besides, the program was created using 10 guidelines on how to make your days happy. However, little is known about youngest children and general and specific kind of knowledge. For these reasons, this research aimed to study the level of health-related back care knowledge in a sample of primary education students. Regarding the methods, a cross-sectional study was performed. Concerning participants, the initial sample was made up of a total of 374 students by competences from 2 public primary schools of the city of Valencia, Spain, during the 2019-2020 school year. But the final sample was composed of 232 students who completed the questionnaires. As you can observe in the table number 1, descriptive data of the sample are registered from 8 to 11 years old in one of the 2 schools and in the total sample. As a selection criteria, we would like to emphasize that students were excluded when not having returned the informed consent signed by the parents or not participated due to the illness or disabilities like autism, Down syndrome, etc., and not having completed all the questionnaires. Regarding the evaluation instruments, we have to say we use 2 validated knowledge questionnaires developed by the Back Health Education Research Group from the Teacher Training Faculty of the University of Valencia. The first questionnaire was concerning about health questionnaire on back care knowledge in physical activities in daily life for adolescents. This questionnaire was composed of 24 multi-choice questions and was administered for students from 8 years old till 11 years old. The second questionnaire was concerning about health questionnaire on back care knowledge in practice, physical activity and exercise for adolescents. This questionnaire was composed of 13 multiple choice questions and it was only administered for older students from 5 and 6th grade in the school. Regarding the procedure, questionnaires were performed at the schools or at home. Classroom teachers could perform the questionnaires at the computer room, or they were allowed to give to the families the guide to complete it at home. The questionnaires were available on Google Forms. All the students voluntarily participated in the study. The management of the centers, the class tutors and the parents were informed about the study in writing and expressed their consent. The study also was accepted by the Ethics Committee in Experimental Research of the University of Valencia. Concerning statistical analysis, descriptive statistics including means, standard deviation, frequencies and percentages were used to represent knowledge of back health data between gender and age groups. The Kolmogorov-Smirnov test was used to test the data normality, and the Mann-Whitney U test were used to compare the means knowledge per sexes and ages. The Kruskal-Wallis age test and Dunn's test for post-hoc analysis were used to compare some pairs of means in educative levels. The level of significance for all comparisons was set at 5%. The data analysis was carried out using the SPSS software. Regarding the results, the Kolmogorov-Smirnov test rejected the hypothesis of normality in both knowledge questionnaires, so we had to use a non-parametrical statistics in the analysis. In the first test or questionnaire concerning knowledge about back care in physical activities in daily life for adolescents, we have to say that it was composed by a total of 229 students in the second and third cycle of primary education. It means students from the 3rd to the 6th grade. In general, the scores obtained in that test were 5.2. Regarding sexes, girls scored 5.4, while boys scored 5.1, slightly less. But we didn't find significant differences according to the test of Mann-Whitney. Concerning the years, the Kruskal-Wallis age test showed significant differences. In the table number 2, we can observe the distribution of scores by age, from 8 years old till 11 years old. Here we can find the median and the mean average. In the table 3, we can observe the Dunn's test for post-hoc analysis that showed significant differences between some pairs of means in some groups of age. Regarding the second questionnaire concerning knowledge about back care in physical activity and exercise practice, we have to say that this questionnaire was completed by a total of 143 students of the 3rd cycle of primary education. It means students from the 5th and 6th grade. And in general, the scores obtained in that test were 1.6. Regarding sexes, girls scored 1.8 while boys scored 1.4. Non-differences were found using the Mann-Whitney test. Concerning the educative level, the students in the 5th grade of primary education scored 1.5 while the 6th grade students scored 1.6. Not showing significant differences between the two groups. In the present study, the main aim was to study the level of knowledge about back health in a sample of primary education students. In general, knowledge about back health was low. The sample in general achieved an average mark of 5 points on knowledge about back care in daily physical activities. This means that only the 50% of the contents proposed in the questionnaire were known. However, when more specific content was addressed, or knowledge about physical activity and exercise on back care, the results were very low or almost non-existent. It means that the total participant sample only showed that they knew 16% of the contents proposed. Along the same lines, other studies found a low level of knowledge in students without having previously participated in intervention programs on back health. The level of general knowledge obtained by the averaging between the two knowledge questionnaires in students from 5 and 6 grades of primary education scored it very low because it is an average of the two previous scores, as we told, and one of them reached very low results. Regarding general knowledge about back hair, in similar studies, Cardone find that 4th and 5th grade elementary school pupils, the maximum score was 4 points in the protest. Similar results were reported in a sample of 200 students from 5th grade from elementary school children aged from 10 to 11 years old, who scored less than 5 points in the general knowledge about back hair in Habibi 2012. In a study composed by 100 female school children from 5th grade aged in 11 years old, reported a mean of 4.1 points. In a sample of almost 500 students from the 4th grade to the 8th grade, aged from 9 to 16 years old, also scored less than 4 points in the knowledge questionnaire. The level of specific knowledge through these questionnaires of the present study was performed in 2 studies with a sample of adolescents, scoring very low marks. According to the age, general knowledge increased every year significantly. However, specific knowledge did not improve very much from 5th grade to 6th grade in similar studies, like in Aparicio Sarmiento 2019 and different of other previous study in Miñana and Montfort 2015. Concerning the use of the approaches of formative assessment, the diagnostic test used in this study could be combined with other formative assessment tools like data-based decision-making and assessment for learning to create more informed learning environments. The thoughtful integration of the 3 assessment approaches should lead to more valid formative decisions for teachers. However, despite the fact that the questionnaires were adapted to the primary education population, it is necessary to develop and validate their own tools for this population in the future. Overall, these results offer us a very clear diagnosis of the level of knowledge related to back health in school age. And furthermore, this is related to the Vygotsky's concept of the zone of proximal development. To create the zone of proximal development by himself, school children needs the more expert individual to bridge the gap between his current development level and his proximal level of development. The more expert means a good quality to carry out the teacher-learning interaction, which is crucial when scaffolding learners learn. For this reason, back health-related pedagogical content knowledge is necessary to apply effective intervention programs at the school setting. As a conclusion, the level of health-related back care knowledge in school children is very low. This study suggests that back health education interventions be addressed in school setting. Maybe teacher training and pedagogic content of knowledge could contribute to improve the health-related back care knowledge in school settings. In the next layout, you will be able to find the references used in this work. Thank you very much to pay attention.